We're going to be talking about a very important topic nowadays. It's pregnancy after the age of 35. And why am I saying it's a very important topic? I mean, a lot of pregnancies nowadays are happening above the age of 35. If you go back a little in history, all the ladies that were pregnant were younger. But nowadays, because all the ladies are becoming educated, they're going to college, they're working, they have a family life, they're starting to get married a little late, and even if they get married, they want to just live their life before having a kids and a family. So we're having more and more pregnancies that are happening after the age of 35. And that being said, even if you want to start having your kids at the age of 30, if you want to have 2 or 3 kids, that means you're hitting 35 or 37 before having to end your family. So it's very important to talk about this topic. But this topic is very serious because we all know that above the age of 35, there is some things that change. I mean, in the past, we used to say an advanced maternal age above the age of 35, but nowadays it's not the same. People are healthy, people are taking care of themselves, and usually if you're healthy and you're taking care of yourself, a pregnancy above the age of 35 may be as good, if not better, than a pregnancy less than the age of 35. But what are the main concerns above the age of 35? We're going to talk about fertility, because we all know then fertility goes down with age. So usually around 75% of people younger than the age of 35 or than 30 usually get pregnant within a year of having timed intercourse. When you go from 30 to 35, that 75% drops to around 62, 63%. If you go above the age of 35, this drops to like around 55%. And when you keep on going with age, these numbers keep on dropping. So if you get older, it's harder to get pregnant. So it is very important to know that before delaying your conception after the age of 35. The other important thing is when you get older, even if you do get pregnant, there is a higher chance of miscarriage, and miscarriage meaning losing the pregnancy. When we talk about younger people, its chance of having a miscarriage is around 15%. You go above the age of 25 or 30 or 35, the chance is like 25%. When you go above the age of 45, the chance is like 50%. So each time you're pregnant, you might lose the pregnancy in half of them. So this is an important point to tell the patients before deciding and delaying their conception above the age of 35. The third and very, very important thing, when we grow older, we have higher chance of having chromosomal abnormalities in the offspring, meaning trisomy 18, trisomy 13, trisomy 21, or a Mongolian baby. Those do increase in risk of having them when you get older. And usually people that are older than 35 have a higher chance of having abnormal chromosomes in the baby. When we're talking 35, the chance of having chromosomal abnormalities are like Down syndrome, it's 1 in 250. When you go to the age of 45, it's like 1 in 20. See how increasing age do increase the risk of having chromosomal abnormality. So it's very important to know that again before trying to delay your conception above the age of 35. If you're healthy, 35-year-old, like I said, you have a pregnancy as normal as a patient that is not 35. But sometimes when we grow older, we start having medical problems. We have blood pressure issues, we have cholesterol issues, we have diabetes, we have obesity, we have many things that happen. And all of these things do increase in pregnancy after the age of 35. So people that are older might have a harder pregnancy, more risks of having medical problems, more risks of having miscarriages, more risks of having chromosomal abnormalities, and more risk of having C-sections too. So it's always important when you're planning your family to know that when we get older, there is a little higher risk of all of these things that I just mentioned, not to mention the higher risk of not conceiving. So keep this in mind before trying to delay your conception above the age of 35.